I'm going to talk to you about lung cancer in general. Lung cancer is the most common cancer diagnosed worldwide. Also, it is the commonest cause of death from any type of cancer. In India, also, it is the commonest cancer diagnosed. Smoking tobacco, both cigarettes and BDs, is the principal risk factor for causation of lung cancer in Indian men. However, among Indian women, the association with smoking is not that strong, suggesting that there could be other risk factors besides smoking. Also, we do not completely understand the alarming rise in the incidence of lung cancer among the non-smokers. We have in particular a limited understanding of the impact of factors that are unique to our region, such as the presence of indoor air pollution, the use of domestic or biomass fuel exposure, the presence or lack of micronutrients in our diet, occupational exposure, and the possible contribution of infection such as tuberculosis. What are the symptoms of lung cancer? Symptoms of lung cancer can vary from person to person. You may have no symptoms at all, or you may feel like you have bronchitis or a bad cold that does not get better. Symptoms which should alert you to see your doctor are a cough that gets worse or does not go away, more trouble breathing, that is shortness of breath than usual, coughing up of blood, chest pain, hoarse voice, frequent lung infections, feeling tired all the time, weight loss for no known reason, or swelling of your face or arms. Some people do not recall having any symptoms at all. Is there a test to see if one has lung cancer before they get symptoms? The chances of curing lung cancer are greater if the cancer is diagnosed early. Looking for lung cancer before it causes symptoms is called screening. Recent research has found that CT scans for screening decreases the number of people who die from lung cancer. So, what are the types of lung cancer? Lung cancer includes two main types: non-small cell lung cancer and small cell lung cancer. The type of cancer is based on how it looks under the microscope. Non-small cell lung cancer includes the following types: squamous cell carcinoma, large cell carcinoma, and adenocarcinoma. Small cell cancer tends to grow more quickly than non-small cell lung cancer. Because it grows more quickly, small cell lung cancer is often found when it has spread outside of the lung or in a very advanced stage. What is staging of lung cancer? Staging is a way of describing how far the cancer has extended. Knowing the stage of lung cancer guides the medical team on how to best treat the cancer. Tests to diagnose lung cancer are: so, what are the tests available to diagnose lung cancer? If there is a reason to think that one has lung cancer, we order a number of tests to look for cancerous cells and to rule out other conditions. These tests uh, may include imaging tests such as an X-ray or a CT scan or an MRI. An X-ray image of lungs may reveal an abnormal mass or nodule. A CT scan can reveal even a small lesion in the lungs that might not be detected on an X-ray. Sputum cytology: if one has cough and are producing sputum, looking at the sputum under the microscope can sometimes reveal the presence of lung cancer cells. Tissue sampling is otherwise called biopsy. A sample of abnormal cells may be removed from the mass in a procedure called a biopsy. A number of ways one can perform biopsy, including bronchoscopy, in which the experts examine abnormal areas of lung using lighted tube that passed down the throat and into the lungs. Sometimes biopsy will be performed by a technique called mediastinoscopy, where the doctor will put an incision at the base of one's neck and the surgical tools are inserted behind the breastbone to take tissue samples from lymph nodes. And sometimes a needle will be used for doing a biopsy, that is called needle biopsy, in which a doctor uses X-ray or CT images to guide a needle through your chest wall and into the lung tissue to collect suspicious cells. A biopsy sample may also be taken from a lymph node or lymph nodes, other areas where cancer has spread, such as from liver. Test to determine the extent of cancer is called process called the staging. Once your lung cancer has been diagnosed, the doctor will work to determine the extent of your cancer. Your cancer stage helps us to decide what treatment is most appropriate. Staging test may include imaging procedures that allow your doctor to look for evidence that cancer has spread beyond your lungs. These tests include CT, MRI, positron emission tomography, otherwise called PET scan, and bone scans. Not every test is appropriate for every person. A particular test is decided according to one's clinical examination finding. The stages of lung cancers are indicated by Roman numerals that range from 0 to 4, which the lowest stages include indicating cancer that is limited to the lung. By stage 4, the cancer is considered advanced and has spread to the other areas of the body. So, what are the treatment options available right now? Conventionally, all cancers are treated by three modalities of treatment, namely surgery, radiation, and chemotherapy. Let us see when are these options are used. Surgery may be an option if your cancer is confined to the lungs alone. Sometimes surgery cannot be performed because of the comorbidity a patient has, like cardiac failure or a severe uncontrolled diabetes, or sometimes severe chronic obstructive airway disease. So such situation, radiation therapy replaces surgery, and radiation therapy uses high powered energy beams from sources such as X-rays and protons to kill cancer cells. Chemotherapy uses drugs to kill cancer cells, or chemotherapy is the method of killing cancer cells by using drugs. One or more chemotherapy drugs may be given through a vein in your arm. It's called intravenous chemotherapy, or sometimes chemotherapy is given orally. A combination of drugs usually is given in a series of treatments over a period of weeks or months, with breaks in between so that you can recover. Chemotherapy is often used after surgery or to kill any cancer cells that may remain. It can be used alone or combined with radiation therapy also. Chemotherapy may also be used before surgery to shrink cancers and make them easier to remove. Probably, apart from the three conventional treatments, one treatment that has revolutionized the treatment of lung cancer is targeted therapy. About 20 to 25% of lung cancers, especially non-small cell lung cancer, is detected to have a genetic abnormality or a mutation in their gene that's called EGFR mutation or an ALK mutation. And if that mutations are present, then there is specific treatment that can target these mutations are available. So this form of treatment is called targeted treatment. Targeted drug treatment focuses on specific abnormalities present in cancer cells. By blocking these abnormalities, targeted drug treatments can cause cancer cells to die. Many targeted therapy drugs are used to treat lung cancer, though most are reserved for people with advanced or recurrent cancer. Some targeted therapies only work in people whose cancer cells have certain genetic mutations. Your cancer cells may be tested in a laboratory to see if these drugs might help you. Immunotherapy is the latest form of treatment available for the management of lung cancer. Immunotherapy is very promising and is very useful in advanced stages of lung cancer where other treatments have already failed. Immunotherapy uses your immune system to fight against cancer. Generally, cancer cells grow by escaping one's own body immunity. So your body disease fighting immune system may not attack your cancer because the cancer cells produce proteins that blind the immune systems. Immunotherapy works by interfering with that process. Immunotherapy treatments are generally reserved for people with advanced lung cancer. So, what are the ways you can prevent or detect early? If you smoke, get the help you need to quit. Avoid secondhand smoke. See your doctor. If you are having a cough that will not go away, having a cough, you are coughing up blood, if you are more short of breath than usual, if you are losing weight that was unplanned, or if you are developing a hoarse voice, or if you are feel tired all of the time, talk to your doctor about screening and get screened to detect cancer early. Thank you.